my name is Cassandra, and I'm going to be talking to you about what I do here at Alliance Medical Center. I am the dental health educator, or tooth fairy here. I'm really excited to share with you a little bit of what I do here at AMC and how we help improve dental hygiene and oral health for the children ages 0 to 6. So just some background on why this role exists is the Sonoma County Department of Health Services created this program because they believe that there was just a need in the community of wanting to help patients in that demographic 0 to 6 who need a little bit more support with dental health education. Just here in the United States, tooth decay is largely preventable, but it's still 5 times more common than asthma. Also, the 2000 Surgeon General's report stated that it's a silent epidemic, that dental and oral disease is a silent epidemic, and called for a national effort to improve oral health among all Americans. And then just here in Sonoma County, 52% of Sonoma County third graders had a history of decay, which is exceeding the state average. So why is this an issue? Why is this concerning? Dental health affects a child's ability to learn and grow. It definitely affects their self-esteem on a daily basis, and it's just it could be life-threatening, and it does cause issues as they grow up, having dental issues and even pain, and it's something that's completely preventable. It's something that we don't have to be children shouldn't have to be going through, it shouldn't be so prevalent among children. And this program is happening now in a lot of health centers across Sonoma County, and it's for children who are eligible, 0 to 6-year-olds. And we usually talk to all caregivers of those age groups and support and find goals for them to meet. The families are provided with a dental health assessment, and they determine whether the patient is high, medium, or low risk for cavities. And the tooth fairies work together with the dentist and the caregivers to find specific goals that family member might need. So it could be anywhere from brushing, flossing, or learning new ways to implement healthier food options. And we're able to create a goal or a plan specific to the patient and their family's needs, because every family has different dynamic and different ways of just going about nutrition and brushing. So usually what happens in a tooth fairy visit is we usually have the patient come in for a dental appointment, for an exam, sometimes x-rays if they're old enough, and a cleaning. And then based on the exam with the dentist and what the dentist finds, is we determine what kind of areas in their mouth they need to more work on. And if we see anything, for example, we see that there's a lot of tartar buildup, we notice that the patient's not flossing at all, or maybe they just have a lot of cavities, then we're able to talk to the parents and ask them what's going on, and through motivational interviewing. And the reason why we use motivational interviewing is because it's a really interesting way to approach inspiring someone. We really want the change to come from the patient and the caregiver, and not just us spitting information at them. So it's a really effective way of creating change in someone's habits. And then from there, when they come back for their next appointment, sometimes it's 3 months later, 4 months later, or 5 months later, then the tooth fairy checks in again with that family and just checks in to see how they're doing on that goal that they made, and also to see if they need more support in that area, or maybe it's just not a goal that they were able to keep, and maybe they need to choose a different goal, and that's definitely okay. And we want to create a safe space where patients are able to feel comfortable to say, I can't do this, or I need more support, I need more help. So we really want them to encourage them to be comfortable enough to say, this is something that's out of my reach. So some of the exciting results that we've seen out of the tooth fairy work is that in 2009 we initially did a Sonoma Smile survey, And in 2009, 6% of patients were referred for urgent dental surgery, and that went down to only 1% in the most recent SMILE survey now in 2019. So it went down about 5%, which is interesting. And also the percent of students with decay in the 3rd grade went from 58% in 2009 to 44% in 2019. So that's a big change. Also, the percent of children who were most at risk or high risk went from 65% in 2017 to 56%. So the changes are slowly but surely happening, and we are hoping that community health workers and community dental health workers in healthcare settings are able to continue to make that difference and really help empower families to create change at home. And I hope this gives you a little bit more insight into what I do here at Alliance. And I'd be more than happy to speak to anybody who is interested in seeing me. I do see children from 0 to 6. And feel free to schedule an appointment for an exam and ask if to also speak to the dental health educator.